All right, so we've talked about history, cannabinoids, and the endocannabinoid system. Let's talk a little bit about the behavioral effects of cannabis. Um, so cannabinoids bind are either the CB1 or CB2 receptor. The CB1 receptors are mostly expressed in the CNS. They are especially abundant in the basal ganglia, so areas of a collection of brain areas that are involved in coordinated movement, the cerebellum, which is also going to be involved in motor control, and the hippocampus, which is learning and memory. And if you go back to the video on pharmacokinetics, when you see that PET scan, you can see this heavy expression within the PET scan that looked at downregulation of receptors in response to heavy cannabis use. CB2 is located primarily in the PNS and is associated with immune responses. It is also found in the glia of the central nervous system and helps regulate the immune response within the central nervous system. Okay. So I just wanted to give you a quick overview of different brain areas that are involved in the THC effects. So here are some of the THC effects. This is certainly not a comprehensive list, and it's not going to reflect the experience of all users. So, for example, paranoia can happen with people when people take THC, but it's not necessarily true. People can also feel a dulling of emotion, right? When they due to THC, or in part due to THC's interactions in the amygdala. Some people use THC to escape having to deal with emotions. That would be an inhibition of the amygdala. The basal ganglia is going to have to do with the slowed reaction time. This is why you shouldn't drive while high on cannabis. The brainstem and the areas here are very tightly involved with your vomiting reflex. So when you reduce activity in those areas, you get that anti-nausea, anti-emetic effect that was really popular in the medical uses. Cerebellum is also going to have reduced motor coordination. Alcohol's effects on the cerebellum are part of the reason, are what you're really testing when you do a in-field drunk driving test. So again, another reason why you should not be driving when high. Impaired memory in the hippocampus. Endocannabinoids are really important for modulating LTP and learning. We can talk more about that next class if you want to hear about it. So when you mess with the very carefully modulated activity of endocannabinoids by adding exogenous cannabinoids, you can end up with impaired memory or difficulty learning. The hypothalamus controls the 4 F's, right? Fighting, feeding, something else, and sexual activity. I'm forgetting the third one. If you guys were here, you'd be able to remind me. But cannabis is going to act on the hypothalamus to increase appetite. The neocortex, which we talk about as the prefrontal cortex, is going to be altered thinking, judgment, and sensation. This is why people who are high do dumb stuff sometimes. And the nucleus accumbens is going to have to do with reward. So endocannabinoids do have a function in modulating reward, which we're going to talk about next class. We can talk a little bit more, and some people experience euphoria when using THC. Euphoria, I think, is a little bit of a misleading word because it, in my mind at least, is associated with a intense spike of supreme joy. But really this is more of like a mellow, I feel mostly good effect. And then spinal cord, the CB1 is actually very highly expressed within the spinal cord, and that might be where some cannabinoids are acting to alter pain sensitivity. So there's a lot of hypotheses about glia, especially within the spinal cord, modulating the sensitivity of sensory neurons of the spinal cord, and those being involved in chronic pain. So one of the reasons that cannabis might be a good treatment for chronic pain is that it might modulate the activity of those sensory neurons in a way, or reduce the activity of glia who are heightening that sensory response to help reduce pain sensation. So physiological effects are bloodshot eyes, dry mouth, intense hunger, or munchies. We're going to talk about a few different hypotheses about what might be underlying why cannabinoids cause munchies. You can see an increased heart rate, muscle relaxation, and drowsiness. The increased heart rate is a little bit counterintuitive. Overall, cannabis is a sedative, or no, I'm sorry, not a sedative. It is a CNS depressant. So similar to alcohol and opioids in that way, but you do see the increased heart rate. Mostly, I think, because of the effects on the brainstem, I believe. You can also experience euphoria and increased appreciation of humor. I once had a student who wanted me to explain the neural mechanism of this increased appreciation of humor, but we can't really do that because we don't really understand the neural mechanisms behind humor, like why you find something funny and why somebody else might not. But you do have an increased appreciation of humor, or maybe just an increased tendency to laugh might be a better way of saying that. The impaired reaction time, again, is going to be the basal ganglia and the cerebellum, and then alterations of perception. So one of the ones is that time slows. So you'll be sitting around for 15 minutes and it'll feel like 2 hours have gone by. That is mostly going to have to do with your perception of time, which is represented in multiple regions of the cortex. So that's some of the system level functions and behavioral effects of cannabis. For next class, I'm thinking about these are the topics that I have in mind. So cannabis and the munchies, there's multiple hypotheses. Within this, we can talk about endocannabinoids and appetite regulation. We can talk about endocannabinoids and reward. This will also play into cannabis's role in addiction and the pattern of use. Who uses cannabis? Who's most popular with? Could we actually consider it a gateway drug, quote unquote? And is it addictive? What data do we have? So we can look at some self-administration data there. We could also look at the role of cannabis in modulating pain. The research here is a little bit contradictory, so that can be a sticky subject, but I can get into it if people are really interested. If there's something else you want to hear about, you're welcome to post it on a discussion board. I'll most likely put up a discussion board specific to cannabis that you can ask questions about cannabis. You can ask questions about cannabis there. And if there's something else you want to hear about, try and let me know before Thursday. If you're watching this after Thursday, sorry, you're kind of stuck with what everybody else has to hear about, but hopefully you find that interesting as well. So you can catch me in class at class time on Thursday, so 11 to 12:15 Central Standard Time on Zoom, and I can answer questions about anything really, but wrapping up the MDMA case study as well as cannabis, the material presented here in cannabis. So if you have done this in the way that I suggested, you've watched these 5 videos, now you're going to go answer top hat questions, some of which are going to be graded for correctness as well as participation, and some just participation. Anything that requires a word answer is going to be just participation because they're too hard to grade for correctness in top hat. So if you have any questions, hit me up. And if not, I will talk to you all on Thursday.